Welcome, Candace. Thank you so much for being here. I I'm always excited to see you. Full disclosure, Candace was my midwife during my most recent pregnancy with my daughter Georgia, and so when we wanted to talk about postpartum, what to expect, she was first on my list to reach out to. So I'm so glad that you're here, and maybe we could start with just a little brief intro. Tell everybody who you are, kind of a little bit about your background, and then we'll dive right into postpartum physical stuff.
Yeah. So my name's Candace Mabbitt. I'm a certified nurse midwife here in Washington State. I actually wear quite a few hats in the midwifery world. I practiced at Providence and Everett doing full scope midwifery. So that means women's health through the lifespan, newborn care, both in a clinic setting and doing deliveries in a hospital. And then I'm actually our Washington affiliate president of the American College of Nurse Midwives, and then our Government Affairs Committee region representative for Idaho, Washington, for the American College of Nurse Midwives. So I can take that midwifery philosophy and apply that to legislation and advocacy and helping to support women through those avenues as well. I'm really passionate about this topic when it comes to postpartum care, mainly because there's a loss both in the healthcare system, but also just culturally. We don't do a lot when it comes to support and encouraging and empowering people and helping them understand what to expect and know. A lot of the time it's the excitement over the birth and the excitement of this new baby, but we don't really honor the woman of this huge transition that happens and then really normalize what they might be feeling mentally or what they might be feeling physically, or just saying, yes, that's normal, but actually it's incredibly uncomfortable and you don't know what to expect or when to call, right? And then in the healthcare system, most of the time, the majority of people deliver in a hospital. And standard hospital postpartum care is we see you at 6 weeks postpartum, which is when everything happens and then you finally start to feel better, you've got the hang of things, and that's when we see you again. But there's this complete loss when you're just like in the throes of it. And so both of those pieces are missing. So I'm excited that we can kind of go through, we'll focus more physically on what you might be expecting and feeling from kind of head to toe, I would say, for your body.
That's wonderful. And that's exactly it. I mean, most of the time women are preparing for baby to come. You do a registry, you do all the things, you get ready, you mentally prepare, at least you have some idea of this birth experience. You know that that's an epic thing you're thinking about. But we don't really think about or even see or hear this postpartum time, and especially this immediate postpartum. And there's a lot of physical things going on. So maybe we could start with just, and I know it's going to be different, obviously, what woman to woman, and depending on the type of birth experience that you had, there's going to be some nuance there. But what are some maybe typical things that women will feel or experience in their bodies after they go from having a baby inside to baby is here now?
Yeah. So I think if we kind of go from head to toe, which I usually start with mental health, but we have a whole other video on that. So we'll just kind of work our way down. First is kind of what do you expect with breast, chest? Are you chest feeding, breastfeeding, bottle feeding? And there can be differences on what you are feeling and experiencing. And then what are those like warning signs of when you should call? Mm-hmm. So in general, initially, you're not going to feel much right after you have your baby, aside from what does that latch feel like? Is it a good latch? Is it a poor latch? And really working with lactation consultants if you're planning on breastfeeding or chest feeding, so you know what that's supposed to feel like.
But we have a whole video on that too.
Oh, so nice. Perfect.
Now we have a whole interview on from a lactation consultant on that. So perfect.
Awesome. The warning signs that we always talk about once you get home is, do you have those cracked and bleeding nipples, which it's still safe to breastfeed, but that would be a reason to kind of tune in, see a lactation consultant, reach out to us, because that's going to increase that chance of mastitis and thrush. And I feel like everything that comes with breastfeeding, as soon as there's one thing off, it tends to snowball, right?
Mm-hmm.
Your milk supply doesn't come in because you're not getting that good stimulation. It's painful for you. You're stressed. You're releasing that adrenaline. Sometimes your baby feels that when you're holding them. They're stressed out. So not having really good feeding sessions overall, right? And so if you can get that support from the beginning, it's going to help. In general, physically, your milk comes in around that day 3 to 5 postpartum. And I just remember feeling like my breasts were very big, and that's called engorgement, heavy, tingly sensations, kind of that let down, normal to just feel like low grade fever, body aches when your milk is coming in that day. And
now, does your milk come in regardless of whether you're breastfeeding or not?
It can still if you're stimulating it. And so if you're planning on bottle feeding, you don't want to stimulate your breast to make more milk. There's already things that are going to stimulate, like release of oxytocin, just when you're seeing your baby and having those love hormones flowing, or you hear a baby cry. And so you don't want to keep stimulating. For instance, you have this engorgement and you think, okay, I'm going to pump a little bit or go in a hot shower and let some of that milk off. But if you do that, it's sending feedback to your brain of, oh, they liked that, I'm going to make more for next time. So suppression, compression with a nice sports bra, nice tight fitting sports bra. And then there is a chemical in cabbage leaves. A lot of people have heard of that, of putting that in, and that helps to suppress your milk supply as well. But there certainly are people, right? There's this whole spectrum where they don't stimulate it, and so their milk doesn't come in, and it's an easy progression to suppressing your milk supply. Yeah. Other warning signs would be if you have a persistent fever, redness in your breast, if you feel a lump there, or just pain at different points in a feeding session, especially that like searing deep pain initially. A lot of times can be like with thrush that you're feeling that yeast infection of the breast.
So the takeaway is if you're a first-time mom and you're going to have some discomfort when you have the engorgement, and there's certainly discomfort with adjusting to nursing, but that's different than pain or redness or bleeding or like continually feeling pain.
Exactly. Yeah. Tenderness from not knowing or having something on your breast every 2 to 3 hours is really different than pain the whole time where your toes are curling and you're really not looking forward to the next feeding session. If that's how you're feeling, really reaching out and getting that extra support is going to be helpful. And then giving your body what it needs, right? The nutrients that it needs, the fluid that it needs, and the rest, which is really hard when you're getting up every 3 hours, but it's important to make sure that you're getting that so your body has the fuel to make the milk and sustain you to have, you know, your health and baby's health, because it's on both of you at that time.
Yeah. And women, especially who are conscious of pregnancy weight gain or have been thinking about, I can't wait to lose weight until after I have the baby. This is not that season. This is a recovery time period where that's not even on the radar yet. We should be nourishing our body's recovery.
Exactly. And you need so much more calories when you're breastfeeding. And it's interesting when you look at studies of just like fat deposit and how it changes where it is in pregnancy to kind of have that equilibrium and balance, but then where it tends to be with breastfeeding. I felt like my whole body type changed from pre-pregnancy to pregnancy. And then it was completely different postpartum and lactating. And I would even jump back and say, not just for first-time moms, right? I remember even with my second child, something felt off. And so just remembering it's a new baby, right? A new positioning. They don't have those neck muscles yet. They're still learning how to suck and swallow and breathe and coordinate. And so giving yourself that time to learn again of this new couplet, this new relationship between the parent and the child, and then really seeing if you need that extra support or not.
Yeah. Okay. That's awesome. So then from the breast, we move down.
And we're going down. So kind of abdomen, we'll start kind of with uterus and bleeding. So normal bleeding postpartum, we say 4 to 6 weeks, but what that looks like is really different from woman to woman and based off of your activity level when you get home. And so a lot of the times it will start off like a heavy, medium period after delivery when you are kind of in those first 24 hours postpartum. And then what should happen is it should be trickling down to more of a light period, then a pink discharge, and then sometimes just a yellow discharge. Really common at times for people to message us for the smell of what that postpartum bleeding is, or what we call lochia. It is a very pungent, earthy smell, and that is normal and okay. Okay. If it's infection smelling, or you're having a fever or tenderness over your lower abdomen that you feel like is getting worse, those would be reasons to reach out and come in. And then certainly if you ever had really heavy bleeding, which we say if you're soaking a whole maxi pad in an hour, that's a reason to reach out. Or if you're having big clots coming out. Once you're already home, it's already settled down, that should not be happening anymore. You would want to reach out. Okay. Mm-hmm. When I say activity level, sometimes what we see happening is it's going down when you're kind of in that immediate phase postpartum, whether you had a home birth or birth center and you're bunkered in your own bed, or if you're in the hospital and you're really only walking like to the bathroom, right? It's not very far away. Then you get home and you have life and things to do, and maybe things are more spread out based off of where your baby's sleeping and where you might be feeding and where your kitchen is. And so you're just doing more activity. And so sometimes you'll see the bleeding starts to increase. And that's always a sign that for you to, okay, I'm doing too much. Let me settle back down. And there's a lot of different cultures that talk about, okay, stay in the bed for 3 to 7 days, then stay around your bed for 3 to 7 days. Then you can increase it outside of your room. For some of us, we get cabin fever and we just can't stay in that setting, but it is a good mindset to kind of just think and pace yourself on it's okay to give yourself that time. It's so normal in our culture to look at it as like a checklist that you have to get through, and at the end you've like completed it, but really give yourself that time to heal and be okay if you're not meeting whatever goals you set for yourself on how you're going to feel.
So question real quick is how big, and I think this female anatomy stuff is funny because sometimes we don't learn it until we're in these moments. How big is a non-pregnant uterus?
Ooh, I don't remember the actual dimensions
like
of it. But in general, let's see if I have something close to me. In general, it should be below your pubic bone, right? So in the after delivery, usually comes back to the level of the umbilicus or your belly button, then usually drops a couple centimeters below. So usually at that 24, 48 hour mark, it's 3 to 4 centimeters below your belly button. But really by 1 to 2 weeks, now it's back underneath your pubic bone.
So it goes from this muscle that is this, big, and then shrinks down.
This size, yeah. Yeah, it's about the size of your fist.
And when you're talking about the recovery that's happening, at least in this area inside your body, and if you do too much, you're bleeding more. Is that because the uterus itself is healing? Is it where the placenta was attached? What's happening?
Right. It's good to almost think, and sometimes that's why it's so nice to see your placenta, which is usually about a third of the size of your baby. So if you look at your baby, a third of that is the size of this placenta that was attached to that inner wall that is now gone. And there's spiral arteries that as your uterus is clamping off that bleeding. So it's almost nice to think of it like a scab, right? If you had a scab that was the size of your placenta on the outside of your body, it would be very easy to make that connection of I need to slow down and take it easy and allow myself to heal. Unfortunately, it's all internal, so you're not necessarily seeing it and constantly getting that feedback. But that's how big that area is initially after delivery that needs to clamp down and come back together. Or what we call involution is that clamping and getting smaller and smaller of your uterus. The other thing is keeping your bladder empty. If your bladder is full, it tends to make the uterus boggy or not clamping down, and then your bleeding can increase. Or especially if it's subsequent children, you'll have more and more after pains, which are those contraction-like pains that you're having, which I personally thought was harder to deal with because they're intense. There's not necessarily a pattern to it. But that's something, if you can keep your bladder empty, will help. And you don't always have the feeling that your bladder is full. Sometimes your urethra just went through a lot. So it's kind of spasms. it takes time for everything to adjust again. So even just kind of putting yourself on a schedule, which can be easy if you match it with a feeding time of, okay, baby has to feed, let me quick go empty my bladder and just sit down and try to go pee. One of those like old midwife things to try is peppermint oil, which is actually a smooth muscle relaxant. And so if you're having troubles peeing, just doing a few drops of that in the toilet, or it can be great to just pee in the shower when you're postpartum, take a shower, put a few drops in the shower, and that can actually help relax that so you can pee. So
it's a surprising feeling that, because you expect your vagina to be sore if you had a vaginal birth, but it's surprising to have that weird, like, I don't want to pee feeling either.
Yeah. And regardless if you had a vaginal delivery or a cesarean delivery, it is still a lot on your pelvic floor, especially if you labored or didn't labor, right? And so it still feels very different. Lacerations, yes, you might have had a repair that needed sutures or stitches, but not always. Sometimes you still have like little grazes, or if you think of, it's very similar tissue to your lips and the inside of your mouth. So I always use that as reference. So if you think of like chapped lips that are cracked and open, sometimes you'll have little grazes like that. It's just inside of your vagina. And so those can kind of sting a little bit. That's why they give you that peri bottle, that nice great squirt bottle that you spray, and it helps to dilute your urine so it's not burning as much. The other thing is just your pelvic floor. I feel like anytime after having a baby, you stand up, it just feels like everything kind of falls. And so then there's this fear in your head of, okay, I'm going to pee, but I also have to poop. And that is terrifying for people. Even if you didn't have a tear, it still feels like everything is going to fall out. And so Kegel exercises, it seems weird to do that postpartum, but it actually will bring blood flow to the area and help with healing. And so I always recommend anytime you stand up and you're going to pick up your baby, or just standing up and moving through space, just be mindful of what you're doing with those muscles. So if you can do a Kegel and think of tightening your core, pulling that belly button to that back wall of your spine, that's going to help bring that whole bowl of muscles up, and then hopefully that core coming in. So that's like the maximum exercise I recommend immediately postpartum, is just being mindful of your muscles and helping them to come back together. When it comes to actually sitting and trying to poop, everything holds. It is very, very rare that a suture would pop open. And that's more often if you had a really significant laceration, what we call third or fourth degree, where it's like really going through your rectum. And then if you have constipation with that, right, where you're really having to bear down. So just making sure you're doing fiber, fluid. We usually can prescribe stool softeners in that case. And then I think just mentally, like I remember having a mental like pep talk with myself. I mean, and you just birthed a baby, so you feel amazing and like this superhero, right? You did this amazing thing, but then you're like, there's no way I can poop. Like, I can't do this. And so one of the recommendations my midwife actually told me was to take a warm, wet washcloth and just, if it's not weird for you, just physically hold over the vagina. And then that will give you that mental connection of like, all right, I'm here. Nothing's going to fall out, and then you can relax and have a bowel movement. And typically it's that first one, second one, and then once you start going, you feel more confident and you'll just continue to have bowel movements, right? And it won't be a big deal.
So it's so funny because this is a lot going on.
So what's going on?
And it's just, you have the baby, you spend maybe 1 day to maybe 3 at tops at the hospital, and then see you in 6 weeks, you go home, everybody celebrates baby, and they know that you're feeling like you need to get better, but this is a lot.
This is a lot. Yes. And I mean, you're dealing with this at the same time of caring for a newborn, right? And so the reality is you're, sitting in the bathroom, you're trying to pee, it's burning, there's lots of blood coming out, and you're trying to make sure it's not too much, but at the same time, baby's crying. Now you're having a letdown, which feels different for people, but that tingly sensation, or I thought it felt like my armpits itching. That's what it was for me, all at the same time. And then having to tell yourself, this is normal. I can do this. I'm going to get through this, right? Your abdominal muscles, which we know split in pregnancy, are continued to be split immediately postpartum. And so you tend to look 4 to 5 months pregnant right after you have your baby, except that everything is going to feel really soft, right? Mm-hmm. So again, just making sure that you're being mindful, trying to bring those muscles together. There are lots of different belly binders and kind of cultural recommendations. They're not evidence-based as far as like having a good study on if it's going to be beneficial or not, but it's also not anything that's going to be harmful. And it's very common for us to do belly binding, especially after a cesarean section where you have that incision, because that counter pressure can feel good, right? Mm-hmm. Mm-hmm. The other fun thing that people don't talk about is just the amount of fluid your body has to get rid of. Mm-hmm. So you double your blood volume in pregnancy, and then most of the time you get some type of IV fluids when you are in labor. So this big fluid overload, and then it's that like first week postpartum where your body's just getting rid of it. So you tend to just have night sweats like crazy. You're peeing a lot. You might have some initial swelling in your legs. And so as your body is going through that, it's just, I think postpartum, you're just leaking from everywhere, basically, right? Like you have baby blues and you're laughing and crying, you're sweating, your breasts might be leaking, you're bleeding. You might very well pee yourself, which is pretty common postpartum as those muscles are redeveloping. So it's just nice to be aware that that's going to happen, that can be normal. And then the best way to prepare is just have lots of extra, right? Mm-hmm. Extra shirts, extra nightgowns, extra breast pads, make your bed twice with a waterproof liner. Yeah. So you could just change it out. It's just, how can you prepare and make that easy? And then how can you give that knowledge to the people who want to support you, right? Because there usually is a good, spider web network that people have of people who want to come in and help, but they have no idea how or what to do. And then there's always, it's just difficult, it feels vulnerable asking for help, especially postpartum, because you also have this whole identity shift, right? You don't even know who you are. You're kind of figuring out what that is as a parent. It feels like a lot of judgment when people are giving you their tips and tricks. You can take it as judgment of your parenting style. And so if you can have a list written out of here's ways that you can help when you come over, and people can just check it off without you actually having to ask, right? Make the bed, do a load of laundry, put a load in the washer, somebody take it out of the dryer. Please take out the garbage. Then it's just easy for people to support you without you having to even think, right? Because sometimes even just looking at your house is overwhelming. Like, I don't know where to start.
They can't do they can't feed the baby for you unless they're bottle feeding. They can't handle that. They're not going to take that first poop for you. There's a lot on your plate, Right. So taking out the trash would be huge, and just having some support. I like the idea of doing the double, make your bed with, double, so that it's easy to change.
It twice, throw it out. I mean, it's the same thing that we would do in a hospital and any other unit, right? Is always be ready to change the bedding out. Mm-hmm. I feel like there ended up being a lot of wet bedding in my household from everyone.
I have to admit that even with my delivery with Georgia, that she was my third baby, I still wasn't prepared for coming home for myself. I was prepared for her. Right. And I did this impulse order from the hospital when I was in the recovery room. And I ordered, I don't know, a mega stack of those circle witch hazel pads.
Yeah.
So I have 40 of them in my bathroom.
But okay, you can use them on scrapes for your kids. Here you go.
What would you recommend if someone was going to have a bathroom kit for post baby? Post baby.
So underwear that you don't really care about, or as much of the mesh panties as you can go home with. Uh-huh. Pads that are the overnight maxi pads. I wish they would make a combination, right, of sizes. They really should come up with that so you can slowly progress down to the panty liner, because I feel like I still have some of the giant overnight pads.
Yeah, and
nobody needs the whole kit.
They are full situation.
Full thing. Yeah. But great to have. The peri bottle you'll want to have close to the bathroom, in the bathroom, warm water in it is going to be best. Let's see, as far as extra washcloths, I would say to have in the bathroom.
Do you like witch hazel? Are you a fan?
I liked the witch hazel. Numbing spray, people really love the Dibucane numbing spray. Ice, I think depending on what your normal comfort is. I really liked having ice to kind of decrease that swelling. And so there's many, I'm sure you could find on Pinterest at this point, many different types of vaginal compresses or different ways to make these ice packs. But one of them is to take like a newborn diaper and actually wet it and then lay it flat in your freezer, let it freeze, and then you'll already have pretty similar to the size pads that you would be having to put on for that ice. The other thing is if you're wanting to do like 6 baths or just baths in general postpartum, bringing warmth to that area is okay and safe to do unless for some reason your provider told you not to. And there's different types of compresses and herbs that people will put in that, but really just warmth is going to feel good in that area. The other thing that sometimes happens as far as just like, is this a normal feeling, is that itchiness that you can sometimes get with scabs as things are healing. Sometimes I'll hear people talk about that initially, around that 1 week time postpartum as things are healing and that inflammation is there and healing those, your vaginal floor, right? But is it itching that's intense, keeping you up at night with a discharge where it might be more of like yeast or something like that is where you would want to then, okay, maybe I need to call and do a swab and make sure that's okay.
Now, there's a pretty big, is there a big range of when women feel better in their vaginal area? If they had a vaginal birth, are most women feeling like, okay, it's not so bad after a certain point, or is it a big spread?
It depends on the laceration. I would definitely say if you didn't have a laceration, and that can be like one of the big game changers from first baby to second baby, and people feeling so much better with their second baby is because they didn't have a laceration. So they feel like they can walk and move around. Definitely not themselves, right? It's creating a new normal, right? And progressing from there, but you don't have that pain and discomfort where you're having to, gently sit down, gently stand up, that type of thing. And then certainly even for a cesarean, right, there you have a lower abdominal incision. You had a major abdominal surgery. And so that definitely is going to take longer. But in general, I would say when I see people at the 2 to 3 week mark, usually you're starting to feel much better by that stage and things are healing pretty well. And then by 6 weeks, it's pretty rare to have continued problems. And if something is going on, it warrants a physical exam and making sure that things are healing in the way that we were wanting them to be healing. Yeah.
If you could, and I don't want to change the topic, if there's more physical things to discuss that women should expect during that maybe first week, but if you had a like crystal ball and you could say, this is the one thing that I would like really give women to support them during this 7 days, is there something in your mind that you would?
If I could give someone sleep, right? It would be.
That's a thing that somebody would be able to get, it's a little more sleep.
And I think even just being able to give yourself permission, right? As that primary parent, which you kind of are if you're breastfeeding or chest feeding, right? A lot of it does come down to you and what your body's doing, but giving yourself permission to change what were your plans in pregnancy, what's your reality, and what's going to fit your family's needs right now. So sometimes that means altering your course on how you're planning on feeding your child, and that is okay. The other thing is permission to rest. Sometimes you're just in that flow of, okay, I'm up every 2 to 3 hours. There's so much that needs to be done that you keep putting yourself at the end of the list. I would say move yourself up to that top priority. Yes, you have to feed baby, but it's okay as soon as that feeding session is done to pass them off, go take a shower, maybe have some music going. So you can't hear if baby happens to be crying, right? They're going to be okay. You've met that basic need, and other people in the household can meet the other needs, right? They can swaddle, they can soothe, they can walk. They're going to be okay. I think it's really hard to do, especially with a first child, right? Which it's great, stare at your baby because they grow so quickly. I think that's okay, but just give yourself that permission to care for yourself because you did a big thing and are going through a lot.
You use the term chest feeding. I've never heard that before.
Chest feeding is a term that's kind of coming out more for our trans community.
Okay.
So sometimes people don't think of the breast, or it's always connected to being a woman or identifying as female. And so chest feeding is another term that you can use.
I'm glad to learn it. I had never heard it before. And so that's really cool.
I'm in the midwife birthing world, and I didn't hear it until our conference last year. And I was like, oh,
yeah, that's really cool. So I think we talked about most of the physical, what to expect in maybe that first couple of days time period. Women are always, at least this is not always, that's not fair. Women often hear that you are back to normal after 6 weeks. You have your checkup and you're good to go. Can we just talk about timeline a little bit?
Yeah. And I always like to bring up sex and just like things in the vagina, right? Because it's this general time that we just said, like 6 weeks. And it's not like anything magical happens at 6 weeks that suddenly you go from not yourself to yourself and now you can do everything, right? It's very different from person to person on how their bodies feel. Some people, by 4 weeks, you feel good and you're able to kind of partake in that. For some people, it's 8 weeks, it's 10 weeks, and that's okay. You need to see first mentally how you feel, and then physically how do things feel. And a lot of time, people don't talk about intercourse postpartum or what it's going to feel like. And so knowing what is normal and not normal, a lot of times are just these weird things that people have thrown out, right? Like it's going to feel more loose, or your vagina is not going to come back together. And in fact, it tends to actually be more tight because you haven't had anything in your vagina. You have sometimes sutures and this healing that's happening where there can be scar tissue that takes time to soften. And so my recommendations for people is feel first. Feel with your fingers, feel around, make sure there's no obvious areas that are really painful before putting anything in your vagina. And that's true with like tampons. You really shouldn't be using tampons for initial postpartum bleeding. You should use pads and nothing in your vagina until that bleeding really decreases. After that, feel around. The other thing that people don't talk about is the hormone change when you are lactating. So your body is focused and the hormones are focused on making and producing milk. They are not necessarily focused on making another baby. So it tends to be really dry. And for women, your orgasm cycle is very different than a male reproductive system, right? It's this circle versus you're stimulated, you have ejaculation, you come back down. For women, you can fall out of that orgasm cycle at any time, right? Can be really into it. You hear a baby cry and you're just like done and you can't orgasm anymore. Same thing when you kind of have this dry vagina. It's common to kind of get in your mind of, oh my gosh, okay, I'm not into it. What's going on? What's going on with me physically? Can they tell? Is there a problem? And then it's just not, you're not going to have an enjoyable experience. So I always think it's great if you can have a talk with partners before that moment of, oh man, my midwife said that my vagina is going to be dry because I'm breastfeeding and that's normal. And so we should probably use lube now if you're somebody who hasn't used lube before. And then if you can actually orgasm before initial penetration, that will help that pelvic floor be relaxed and have more of your natural lubricant. And then just being able to play with it and have open communication with your partner of different positions that may or may not feel good. You know, maybe you try and it just isn't feeling good. And so feeling comfortable saying, you know, we'll try again in a few days or in a week or whatever, but not feeling obligated, right? It should be consensual. It's your body. It should be fun for both individuals. And so just making sure that you physically and mentally feel ready for it. And again, giving yourself permission to say, just kidding, I'm not ready yet. Let's wait and go from there.
Nobody really talks about it.
Nobody talks about it.
Yeah, nobody talks about it. And usually even at your 6-week checks, you know, you'll hear, okay, you're probably good to go, you know, if you're ready. But it's not like it's not a discussion about how to make it enjoyable or, you know, that it's okay, that you're kind of on a spectrum here of like, and even that hormone thing. I hadn't heard that before. I mean, I think they might have thought that, but yeah, nobody talks about that stuff.
And just in general, right? Even outside of postpartum is like, when do we talk about sex and who are you supposed to go to for it? So I'm always like, if it's not your midwife and you can't bring it up with your midwife, then there's this huge loss, right? just a whole other conversation that we could have. The other thing to keep in mind is just ovulation patterns are so different from person to person. So you'll typically ovulate before you have that first period, which for some people can come at 6 weeks postpartum, right?
That's what I was curious to ask.
Some people have like this 3-month break, 6 month, 1 year where they don't menstruate at all, but you're not going to know what it is for you. And it doesn't necessarily match pregnancy to pregnancy. It's always different. And so you just want to kind of think through, what are your family plans? Would you be okay with getting pregnant again right away and therefore don't want any forms of contraception? Or are you somebody who would want to space out, or you're not quite certain if you want to, childbear anymore? Those are things that you would want to think through and then make decisions that are right from your family when it comes to choosing a birth control and going from there. And I usually say, always stay on your prenatal vitamin.
Is it true that you're more fertile right after a baby? Is that, or that just a myth?
No, that's just a myth.
I heard that it's because because everything's real opened up in there that you can get pregnant more.
You still need the basics of like ovulation, right? There still needs to be an egg. And so you have to be ovulating, and it's not like later in life where maybe there's multiple eggs coming at once. So from that standpoint, it wouldn't necessarily be easier. But depending on, if you think of positioning of the cervix, what's that discharge like? Is it that egg whitey discharge that's going to pull that sperm right in? Or is it more kind of dry and focused on breastfeeding? And
I think the myth says that because a baby just came out that there's a straight path in.
No. I mean, if you're having sex right after, but you shouldn't be ovulating. You shouldn't be ovulating right then. So there wouldn't be an egg where you could get pregnant. But I would think just in general, probably your day-to-day life has changed. Mm-hmm. It's not really your focus. It's not something that you're thinking about, right? And so certainly having unplanned pregnancies are not uncommon. So it's just good to know. And there's a myth that you can't get pregnant postpartum, right? Mm-hmm. Especially if you are breastfeeding, which isn't necessarily the case. That lactational amenorrhea has very, very specific criteria that most people do not meet. It's on-demand breastfeeding on the breast. So once you add in pumping, it actually doesn't count. There's like a chemical exchange that happens there. As soon as baby sleeps 4 to 6 hours, doesn't count anymore. You could ovulate, right? And so, which is great. You're like, yes, my baby's finally sleeping, but I could get pregnant now. So most of the time it's good to kind of think through what are your desires, and then have a plan in place. So plan in place in pregnancy, so you already can kind of follow that path postpartum, and then you don't have to think about it.
Mm-hmm. So then maybe the last place that we can wrap up is return to activity, similar to intercourse or anything that happens. A lot of women are told that 6 weeks, you're good to go. You could go back to your activity. And that may not be true. And where would there be maybe a need for some postpartum physical therapy or some support,
Yeah. It's interesting, right? Because there's some countries who do like pelvic floor physical therapy is just part of their postpartum care. And so after that 6-week time period, you get a referral and you go see a pelvic floor physical therapist, right? Not super common for us. And then medically, it's like, is insurance going to cover that? But always feel empowered to ask your provider of, hey, this is how I'm feeling. Can I go see a pelvic floor physical therapist? So they can do a full internal assessment of those muscles and give you feedback. But certainly if you're, peeing when you're not planning on peeing, if you're feeling that pressure or you feel like something is coming into or out of your vagina, those would be reasons to see a pelvic floor physical therapist. And then just in general for exercise and activity, it really is getting feedback and listening to your body and kind of personalizing it for yourself. And again, not having some big goal that you're trying to push yourself to meet, right? The goal is just adding movement into your day, adding strengthening into your day, which you're already doing, just like picking up and moving this little one around, but trying to be cognizant of what's my abdominal muscles doing, what's my pelvic floor doing, how can I bring that up, and just having those smaller tightening is going to go longer than if you immediately try to jump into, running and doing burpees. Like those types of things are just pushing down on your pelvic floor over and over. So if you didn't strengthen that, it could lead to like long-term problems. Right?
Mm-hmm. I liked the description that you mentioned about the bowl and how it dumps out forward. If you like your pelvis being a bowl, one of the return to exercise cues that I used for myself was once I could no longer keep that bowl level and I started dumping, then I was too tired. My abdominal muscles were tired. I needed to rest.
Right. Right. If you can't do good form, right, what's the point of doing the activity? And it's okay to kind of bring it back down, really focus on that form and increase from there. I think also just like the abdominal pressure, right? If you're really pushing into your abdomen and you're pushing out those muscles and not pulling it in, not using those big quad leg muscles, you probably don't have great form and you're not ready for whatever that activity might be.
Mm-hmm. Mm-hmm. Was there anything else that we didn't cover that you can think of?
Those are my
so
big,
great.
my big postpartum talks of things to look out for. And then I think just making sure that you have your resources, right, to reach out to, either if it's clinically, and not being afraid to ask silly questions. I think in general in reproductive health care or women's health care, everything feels like a silly question because it's never talked about and we're never really taught growing up what's normal, what's not normal. Many people really haven't thought of that anatomy until they are menstruating or then they're pregnant, right? And so just know it's okay if you're not certain and it's something new for you, it's okay to reach out and ask. There's no silly questions. I don't have a list of the top questions that I think are ridiculous, and I don't remember them. They're just always coming, always new, always challenging us as providers. But you want to feel validated or empowered or get your questions asked. We don't want people to sit at home wondering.
Yeah, you don't want to be alone. And I think that that's one of the reasons that we wanted to do this interview and that we have, you know, the FIMI Mama program is so that you have more information, so you feel less alone, you're more connected. I know that, you know, having a doula can be helpful because a doula can provide some of that postpartum, you know, support. And I didn't know that at first, but that's really helpful. And then I think just finding some people who you've had a conversation with, like you said, these are the things I think I'm going to really need some help with, and can you help me, you know?
And those bigger gifts, when I think of like, what's the best baby shower gift? Mm-hmm. I would say having like a honey bucket fund that goes to a postpartum doula or a doula for both. And then like a cleaning lady, right? Because you don't care as much that they're in your house cleaning up. Like if you could have somebody come for that service at 2 weeks, right? That would be amazing.
Yes, that would be huge.
I'm always like, just do that. Diapers or some type of way to not have their poop all over you. It's probably nice unless you're planning on not using diapers. And then those two things, like that and food, I think those are the best.
People, you know, if you have a community, a local community, people like to do meal trains, but if not, then maybe putting it on your registry list and getting a couple months of one of the, you know, the at least the ones that send you everything and all you have to do is put it together, you know, and it's healthy, nutritious food.
Yeah. Or even, I mean, we have like, depending on where you live, right? Uber Eats and stuff too, where you can just go on, what's your favorite food? Here you go. Let me send it to you. And it's a way that even family and other states can send you good food and you don't have to think about it. Right.
Mm-hmm. Yeah. Well, this was wonderful. Thank you. I learned a ton, and yeah, I just really appreciate this. This was really fantastic.
Well, thanks for asking. I love talking about it anytime.
Yeah.